Doing quite a bit of implant work
Mhm.
right now. Tell me a little bit. I guess for layman, I'm not missing any teeth or anything. So maybe give me an idea of what dental implants are and problems that they can fix for people.
Well, the thing with implants is it's kind of a miracle in dentistry, actually. In the old days, if you lost a tooth, I mean, you were looking at, a bridge where you crown a tooth on either side and have a tooth hanging in the middle. So you're crowning teeth that didn't need a crown in order to fill in the space,
Hmm.
or you'd use something that would be removable, would take in and out, which often became much more removable than fixed. Um, or you left the space, and it would be perhaps unsightly, and it was difficult to try and chew around this empty space. Well, with the implants, for the vast majority of people, just a little procedure. You put this little titanium screw-like thing down into the bone, and you give it 4 to 6 months, and your bone grows and holds on to that little titanium screw. It actually affixes to it. It's like part of the body now. Then
Right.
we can put a little post on it and cement a crown or cement a bridge, or like today I had a lady where we took an impression to put a crown on a front tooth that's missing, and we
Mhm.
also took impressions to do a lower partial denture that snaps onto a couple of implants. So instead of moving around like most people's partial dentures will, or flipping up and down, it
Around
snaps
that.
in. Um, Eventually, my guess is she'll get a couple more implants and we'll put a couple of fixed bridges in, and she won't have anything removable in her mouth. But for now, it's saved her thousands of dollars. She looked at going to one of these implant clinics and was going to, pay like $15,000 to do the same thing that I'm doing for, I guess it's about a tenth the price, which is hard to believe. Maybe I need to raise my prices, but she is so happy, and she's happy to get it done right now at the end of the year, and write it off for taxes or whatever. I don't know all that stuff, but she was excited that we had this ability to do this, and it's not tricky. I mean, I've done it for several years. Any dentist could do it if they just wanted to, but I talked to a lot of dentists, and they're afraid to do this, and I'm not exactly sure why.
Hmm. So
Mostly it's the oral surgeons that do it.
with the implants.
Yeah, I work with an oral surgeon who's kind of my mentor, and he helps me to become better and better as we go on. He's an expert, and a lot of the implants that I diagnose, I can't perform. They're a little more outside the norm. They're a little trickier. But
Mhm.
I've got a great oral surgeon to refer to. I have great specialists that I use, and he helps me so that my cases